Returning to the continuation of our clinical case, where I explained to you in the first part all the environmental adjustments we made for this patient, now we will present to you how the surgical procedure was conducted. So, while planning the surgery for this patient, where we planned for guided surgery, we developed these guides that are part of our BDS magnetic guide technique, which are magnetic guides. If anyone wants to know a little more, just check out the other lessons we have here on YouTube. In one case, I had the chance to explain more about what magnetic guides are, and you learn a bit more. So in today's video, we won't have time to discuss this issue in depth. So this guide was used. This guide, as you can clearly notice and observe, was a guide that used the biosplint in this particular instance. And the biosplint, when you use the biosplint, in your case, instead of sterilizing it with an autoclave, a hot sterilization, you can do a chemical sterilization when using the biosplint. In other words, sterilize by immersing the surgical guide in chlorhexidine, in 0.12% chlorhexidine, for 2 hours before the surgery. So in this case where the biosplint was used, we adapted this first guide there in the surgery part. And after we adapted this guide, this upper part serves as a reference for seating on the patient's remaining teeth in order to effectively and efficiently. And after this guide is carefully placed, then the anchoring pins, this upper part of the guide is removed, and we have the base guide securely in position. After positioning this base guide, we started the entire drilling process for the implants, where a second guide is attached. This second guide, which you can see in this image, fits over the base guide, and then we began the entire drilling process for the implants and the installation of these implants. So here, as you can see in the image, we used the socket shield technique, where we partially left the root in this region of the incisors, and we will also submerge, bury the laterals, and one more premolar here in the back, where we are going to perform the root burial of these laterals. If you want to know a little more about this technique, just follow us on social media, on Instagram, where I talk a lot about the socket shield technique, which we have been developing in many cases, including the use in single cases. And we have the opportunity to explain better on social media, referencing articles and everything else. To know more, follow us. Okay, so in this case where we place these implants, after placing these implants, we also continued using the biosplint in the fabrication of these custom healing abutments. What are these customized healing abutments? Made in software specifically for this patient, specifically for each tooth. If you notice, we have a number here on each healing abutment indicating which region each abutment belongs to. So we have the healing abutment here for the 13, the healing abutment for the 11, the healing abutment for the 21. These are custom healing abutments made and 3D printed. And these healing abutments, which are designed to properly and effectively play a role in maintaining the gingival tissues in the correct and desired position, because the patient's provisional will be made later on. Could I reline this provisional and adapt it right there during the surgery? I could. It's a workflow. I believe that this is a lot of work to do during the surgery, after a tiring surgery like this, to then have to make a temporary adjustment. So I prefer to send it to the lab and receive the patient's provisional in 2 or 3 days, which is a fixed bridge with no gingival compensation. And to keep this gum in its current position with the patient's gum condition, if I use a common healing abutment, I will have a collapse of the tissues with this common healing abutment. So I need to work in this direction using customized healing abutments in order to maintain the exact emergence profile of the gingiva in a precise manner exactly as it is, and ensure that the exact emergence profile of the gingiva is maintained throughout the entire process until the patient receives the provisional restoration. So in this case, we also removed the de-epithelialized connective tissue and left the keratinized portion that you can see here, which we call a little clock because it looks like a watch with a strap. This circular part here is the keratinized portion that was kept, and the rest was de-epithelialized connective tissue for placing this tissue in the lateral region. This surgery was conducted by my very great brother and additionally my extremely great partner. We performed the surgery and it was Dr. Alexandre Teixeira who handled all the gingival surgical procedures for this patient. And here we have the radiographic result, which you can see in this image. In this radiographic result, a panoramic view, we can see the root burial of the 2 lateral teeth that we left. There's also a premolar that we left here as well. And the socket shields, which can't be seen here, are the roots that are basically in front of these implants to preserve the entire volume structure. And here are the temporary dental restorations that have been installed in the patient, already about 2 days post-operative, and they seem to be holding up quite well. Look here, the temporary is being installed. It still looks somewhat aggressive, but I want you to follow along with me to see how this tissue will behave slightly. And for those who do a lot of connective tissue grafts and know that EGL, when we do a lot of EGL grafts, we often think we've lost all the tissue when we see an image like this. But in reality, we always end up yellowing a bit of this tissue, superficially necrosing this tissue, but we can still achieve a gain in the internal part. So here you can see a result that we have here of approximately 2 weeks, if I'm not mistaken, here in this result, approximately. And we actually have these healing abutments right here. Sorry, this one is not yet exactly 2 weeks old. That case was on the day we installed the temporaries. So we did the installation of the temporaries. And then you can see these temporaries installed. And we already started, and after this tissue fully and completely healed, we ended up beginning to condition the gingiva. Not immediately after the surgery, we have to give some time for the tissue to respond. So in this image you are seeing here, we already have the connective tissue that was inserted in this region, and we have approximately 90 days of work. The waiting period for osseointegration is also 90 to 120 days, during which we wait for the maturation of this tissue. Now we are conditioning this tissue either with acrylic resin or with fluid resin, and you can keep working this way to keep improving. And here is already a second set of 7D provisionals that you are seeing with improvements in the aesthetic part. You saw in the previous image that the teeth were already becoming very large and elongated. So we decided to make a second set of provisionals, but once again using the high quality, well-known and trusted BioCrown resin material for this second set of provisionals. Look at how I have this issue of tissue improvement here. So still working with a system of teeth in natural sizes, that is the MISC PF1 classification and the maturation of this tissue. After I did that tissue conditioning for 120 days, I then introduced this second set of provisionals to achieve the aesthetic improvement I needed. So what are we talking about here, folks? We're talking about me entering around 4 provisional games, 4 sets of temporary restorations, and at all times we made use of printed temporaries in order to reduce costs without compromising aesthetics in any way whatsoever and efficiency in the process. You can see everything printed, this provisional. Look at the aesthetic quality we have in this patient and the tissue aspect. It is a biocompatible resin, so it is a resin with a bit of ceramic load, which gives you this quality of tissue maturation precisely because you are using a good quality material. Look at a profile view 6 months later, where you see the maturation of this tissue. The keratin we created in this region and conditioned. Look at the beauty of the papilla and everything else we have, all still with the printed provisional. But Leandro, why 6 months later? It's because she is one of our course patients, folks. She doesn't have many means to get the work done, so we have been doing things gradually and waiting for the right time to complete it because she is a patient who gets the work done within our courses. So in our course, we have to wait for the patient to gather the funds to proceed. And then in the end, what will be the result of the definitive prosthesis that you will deliver to this patient? I am going to deliver a final prosthesis with the same BioCrown resin printed for work. I don't like the term final, but I prefer the term long-lasting. So these are long-lasting resins. You will safely use the resin to deliver a definitive prosthesis to the patient with BioCrown resin, a nanoceramic resin. And if you want to do ceramic work on this patient, which is the goal for this patient, it is to do ceramic work. That's why I told you that she is capitalizing herself. So if you are going to deliver a ceramic work, everything is already ready. Whether you are going to scan the patient, take the impression, do the scanning, and deliver a ceramic prosthesis, or deliver a prosthesis in a resin printed with nanoceramics to ensure a long duration of these prostheses. Wow, Leandro, what if these temporaries break? What happens, folks? You simply and easily print another complete set to conveniently give to the patient. The overall cost is significantly much lower compared to traditional ceramics. So it depends on what the patient can afford to pay. Today, this patient also ended up doing the grafting on the lower part slightly. We are rehabilitating the entire patient. So she is undergoing grafting, she had bone regeneration in the lower part, and we are waiting for this patient as she is still in the healing process of the lower bone graft we did. She will still need to get implants. Then we will have to wait for the implants to be osseointegrated so we can place the implants and then wait for the osseointegration period of the implants, and only then can we start making the definitive prosthesis, both for long-term use, both from the upper part and the lower part. So today we are practically at the 2-year mark with this patient, and she presents herself there, as you can see, with the BioCrown, which is the printed resin we used, and still super comfortable with the aesthetic part and the functional part of chewing, as you can see in this image. And that's it, folks. That's what I had to tell you. It was a clinical tip that I wanted to discuss with you in a quick case where we talked about the issue of printed provisionals in conditioning, both in the initial gingival conditioning, that is, in the management of the initial tissues, right, in the preparation of this patient, and later in the provisionalization over the implant. I hope you enjoyed it a lot, and if you have any questions, feel free to ask us. We will be more than happy to answer all your questions. Big hug to everyone.